Good morning. I am Dr. Aisha Mohamed Mwatuwano, family physician trained in Cuba and also the current Deputy Medical Superintendent of JM Kariuki Memorial County Referral Hospital in Nyandarua County, Kenya. All right, so my journey started back in 2022 in July, whereby I realized in our outpatient medical clinic, we will see around 70 patients, and that was really exhausting. And also, there was a rise in patients having complications of diabetes and hypertension. So I'll actually ask myself, why is this happening? And I thought to myself, the best person to ask was definitely the patients themselves, because they will know more. Yeah. And then as the days went by, looking at the patient's records whenever they could come, they will have high BPs or high sugar levels. So I'll inquire more. I'm like, why would you have this? They're like, doctor, we have not taken our medication. We will be taking our medication once you're done with the clinic. So I still asked again and again why. They told me by the time they leave their homes, it's around 5 a.m. At that moment in time, they're not thinking about taking their medication. They're thinking about having to rush to come see the doctor. And then by the time they actually arrive at our facility, it's around 6:30 and 7 a.m. So I realized these patients come from very far. So why would I allow them to come this far, use a lot of money, and yet again they complain that they do not have enough money to buy medication? So I told myself I could simply reduce this distance, save on their transport fare, so that they can actually use that money that they have to buy medication, and at the same time have access to a doctor at their home, at their homes. Yeah. So I actually borrowed a vehicle at the hospital level, whereby it would take me to the dispensaries, to the health facilities, to actually see these patients and then come back on the same day. Now, my challenge was the patients were also so many. So I took it upon myself to go with a clinician so that they can actually help me with the work, but at the same time decided to divide the patients. I was like, no, 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 you cannot all come on the same day. I will see some of you on today, and then I'll see the others, let's say after 2 weeks or 3 weeks, and so on. So it went on like that, but I also realized that I needed to capacity build the healthcare workers who are actually present at the level 1 and the level 2 hospitals to actually know what to do or how to take care of emergencies when they come about. And also encouraged having health talks at the community levels, whereby if I'm not around, they could simply educate each other and live better lives or accept their situations as being diabetic or hypertension. Another thing, oh my God, I can go on and on and on and on. Another thing was about medication and screening for diabetes and hypertension, all that. I tried as much as possible to improve, which I can actually thank God for the energy that He has given me and the efforts of the other health workers for accepting me as a doctor to be able to help them and also help the community. Now, the next video is about a patient who actually talks about his journey, whereby he had an accident and then was diagnosed with diabetes and hypertension. Once we met, this patient was not at his best condition. I took him through a lot of counseling, which actually had to do it myself. I took him through the importance of adherence to medication, importance of accepting life and living a day at a time, and also the importance of being strong as a man and living as much as he was depressed. So my patient actually improved clinically. His blood pressure improved, his random blood sugars improved. We did screening of diabetic nephropathy and all the rest, and it really, really improved. So I cannot thank God enough for this journey. I am grateful, and I would still advocate for more people to do the same. Thank you so much. Kindly feel free to peruse some of my journeys in the photos that I took and in the videos that I took on my way to the different parts of Nyandarua County. I am happy, I am at peace. Thank you so much.
Habari yako? Nzuri. Karibu Shalom. Asante. Hapa ndio kwetu. Mimi ni patient wa hii hospitali na tumeendelea sana na daktari. Kuanzia pale nyuma nilikuwa nashinda sana. Wakati nilipata accident, nililala kwa nyumba. Nikashikwa na sukari, nikashikwa na pressure, sikuwa ninajua. Sasa wakati daktari alijua nilikuwa mahali paya sana. Juu singeweza kutoka kwa kitanda, singeweza yoyote. Nilikuwa nimesukumwa sana na hiyo ugonjwa. Lakini wakati daktari alijua, akaanza matibabu kwangu. Akaanza kunitibu, halafu nikajiunga na kikundi chetu cha hapa Shalom. Ndio tukaanza kushikiliwa na daktari, ametupa mawaidha, ametupa dawa, mpaka ikaanza pande yangu kushuka. Tumepelekana mzuri na daktari, nimeimprove, nikaanza kutembea, nikaanza kujifanyia tukazi twangu tudogo tudogo. Sasa mpaka wakati huu pressure imeenda chini, sukari imeimprove. Tunafurahia sana masomo ya daktari. Anakuja anatusomesha vile tutakuwa tukikula, vile tutakuwa tukioga mpaka mguu. Mambo yetu imekuwa mzuri. Juu tukikutana na hiyo kikundi yetu ni kama furaha. Juu kila mtu anashukuru daktari vile tumeenda mzuri. Sasa tunashukuru daktari wetu, aendelee hivyo hivyo. Na mwenye ako nyumbani asikae nyumbani, akuje tujiunge ndio tuendelee na masomo yetu pamoja, na ataona mabadiliko. Tunashukuru sana daktari, hata vile anatushughulikia mambo ya dawa. Kuna wakati inaenda hivi tunakosa dawa, inakuwa gumu sana. Juu ni shida, wengine wetu hatuna mapato ya kupata pesa tuende kwa chemist, inakuwa shida. Lakini daktari anajaribu, anatuletea ile anapata, tunaendelea mzuri. Asanteni.